there's no doubt that what we've done so far has had an impact. What you have done so far has had an impact. And not a small impact, a big impact. And that's to your credit. So well done. At the same time, there's more to be done. And it's like you're in a marathon run and you get halfway and you wonder if you're there yet, and you thought you're going to be close to the finish line, and the coach says you have more to go. But at the same time, he said, you've already trimmed a minute off your time, so keep at it. And so in that sense, I want to encourage you to stay the task. We're finishing this 14-day period. That was one of the largest times when we had 2 weeks ago people coming back into Ontario. And that's one of the things when we're looking at the modeling in that. Part of the challenge of we had in Ontario is that we've had 3 times we've had large movements of people from epidemic, or I say endemic areas, into Ontario. And we've had to do case contact management. And we've done 2. This is our 3rd one. And we need to do this one as well. And we're through that phase with the people coming close, because 2 weeks ago today, that was about the 20th of March, and I noticed the numbers from the border security started to drop off quite considerably on about the 23rd and 24th after that weekend, as people who still went away for March break were coming back and others had stayed put. So we're trying to see that. You'll see the numbers today are still significant as we have ramped up our laboratory testing, and Dr. Yaffe will talk about those in a moment. But it certainly speaks to the need that we need to continue to be stalwart in our efforts to do our physical distancing, hand hygiene, and look at all those fine aspects around there. And I'll talk more about that in a moment with some of those other public health measures that I've already recommended we put forward that we're in the process of implementing now, and other ones we need to consider as we endeavor to go for the next 2-week period, which is I call the other side of the major inflow, and we see senses of how well our social distancing, people like the word physical distancing, and our public health measures have been working, continue to work. And as Doctors Brown and Donnelly have said, by being even more vigilant, we can push it down even further. And I think that's encouraging. While the numbers are startling, it tells us that we have come a long way. It's like when I used to work for years in Nepal, when we walked up hills up and down, it seemed like a long way to the top, but when we look back down, look how far we've come. And so let's keep building on that and be encouraged by that, but mostly stay to the task. And can we even do it further and better in the weeks ahead? So let's go to the numbers over first to Dr. Yaffe.
Okay, thank you very much. So as of the data for 4 p.m. yesterday, as reported in the Integrated Public Health Information System by public health units in Ontario, we have a total of 3,255 confirmed cases of COVID-19 in Ontario. This is an increase of 462 cases from the previous report and includes, unfortunately, 67 laboratory-confirmed deaths. We're aware of at least 32 outbreaks in long-term care homes, which are related to 24 deaths, some of which would be lab confirmed, some would be epidemiologically linked to the cases. The good news, we're continuing to see an increase in the cases that have been resolved. We're now at 1,023 resolved cases. In terms of hospitalizations, we currently have 462 patients with COVID-19 in hospital in Ontario. Of those, 194 are in ICU or intensive care unit, and of those, 140 are currently on a ventilator. The laboratory testing, at this point in Ontario, almost 67,000 people have been tested for COVID-19. We have, in the last 24 hours, processed close to 5,500 tests, and what we used to consider a backlog, we currently have 1,245 tests for 2,400 tests for 1,245 people are still in progress, and if you consider that is well within the daily testing capacity, so really should not be considered a backlog at this point. Thank you.
So thank you on that. And as you heard from Dr. Donnelly and from Dr. Brown and from Matt Anderson, what we need to do more of and how we can endeavor to keep those numbers down and to not only flatten the curve, but to even push it down further, I think is within our grasp. And as you saw those numbers, they're not talking about 4 or 5 months off. The numbers were actually until the end of the month, and then further beyond that. So our task is ahead of us, and I think we need to work at that even further. Now, we've already put more measures in place for the long-term care sector, working with the Ministry of Long-Term Care and with the public health departments who work with the long-term care facilities. Those new directives just came out this week. We are assessing the ability and the capacity to deliver on all those components and to assist where necessary to endeavor to implement these new measures in that regard. Increasing the testing, increasing the surveillance, limiting the visitors, ensuring our healthcare workers are protected in various ways, and to make sure that we are backing it up with accurate data collection and monitoring of those situations in that regard. Even though we've had a number of cases, you have to understand the population we're dealing with here. When we talk about some of the numbers today that Dr. Yaffe just told you about that are impacted by this, some don't realize that we have in long-term care and transfer care over 78,000 individuals. So this is not a small number. And with a number of institutions and facilities, when we're looking at right now about a 0.2% rate, that may seem rather small. That doesn't mean that those other ones are not a concern to us. They are, and we would like to drop that down. I'd like it at 0. But that's perfect. That's a charge, and that's a target to go for. So we don't give up. We don't let that go. We keep working at that. We've asked that people continue to do the physical distancing, especially this weekend. It's going to be better weather. You can do your own version of outdoors without going to parks and other popular places where you will be unable to maintain social and physical distancing. That is not what we want, and that's exactly what we like to discourage at this time. And there's some people who feel it's a casual thing, it's not a big deal. And what we're trying to do with our long-term care residents, whether over 70s, and with you and your household aspect, in the hospital sector, we call that reverse isolation. And even when we do isolation aspects in hospitals, sometimes when we've been involved in it there tends to be some sense that maybe this is a bit over the top, it's unnecessary. The data you heard today tells you it is only but necessary, and it's important to stay the course on all those aspects, and they're important. Small slip-ups and in times of casualness have impact, and that's true when we're doing isolation in hospitals. What someone deems to be, why go through all that bother, just duck in. I'm glad to say that our hospital staff take that very seriously and do it with great diligence. We have to emulate that in our lifestyle here, and this is a change for a lot of us. And a lot of you have adapted to that. You're doing a great job at it, and you need to stay the course in that way. And that's why we're trying to help you to get all that as best you can, to update you with the data and information, because you're part of the solution. You are the solution, and it's in your hands. And that's one thing, unlike some other things with different conditions. When you're each evening in the house, your house where you have your essentials, you have your warmth, you have your comforts, and you know you have your health of you and your family, that's the thing that some other parts of the world don't have. But we as Ontarians, even if it's your condo or your apartment, you have that sense of security because you've done everything you needed to do that day to endeavor to keep yourself, your family members safe, and you can take and solace in the fact, if you look back and reflect on that, you've done that. That's another challenge I want to give you on the way forward here. As we do this next phase of increasing the case contact, follow-up of public health, that's the next phase. In that, even more follow-up, because you saw almost 50% of the cases, information is pending. The travel amount is going down. And that means, not surprising, because the travel has gone down. And you have to endeavor to work on that 50% and do all that case contact management. Part of that is that when you are involved, either you're a contact of a case or you happen to become a case, we need you to reflect very seriously, what did you do in the last 2 weeks? And if you don't make a point of noting that, when we ask you, say, were you in any close contact with person A or B or C? You say, I just can't remember. We would like you to remember. You need to take track of that. It's like your track record. Where did you go? What did you do? So pay attention to that, because it may be that by happenstance you did come into contact, and we'd like you to be able to recall that, because that'll help us in our case contact. Because if you are a case, you got it from someone. The question is how. And it'd be excellent for you to remember, and critical for you to remember, where you might have had that exposure. So the numbers are real. The numbers are challenging. They may, for some people, a bit scary. I think the need is that to turn that apprehension into determination to do what we need to do, because we told you what you need to do. You can do it. We have made an impact. You have made an impact. And as the Premier said, we know that our people in Ontario are up to the task of doing that, and we'd ask you really to focus hard on that for the next 2-week period in this post-travel impact time, to really come up with strong public health measure in delivery and consistency. So with that, we'll open up for questions.
Okay, we'll take the question from the first caller.
Your first question, Rob Ferguson with the Toronto Star. Please go ahead.
Hello, Doctor. I'm wondering, given what we saw from the modeling earlier today, do you have any regrets that you didn't, and what you were just saying now about travel, do you have any regrets not advising people not to travel until that Friday before March break? You know, that warning came out the day a lot of people were leaving or had already left, and a lot of us were wondering if that shouldn't have been issued a week before, and if that couldn't have saved more lives.
It's a good question. We'd ask people to not do any non-essential travel already. And, of course, before the March break, that's why we moved quickly to close the schools on the evening of the 12th, which the 13th was a PA day, and people were in the process of undertaking and planned to head off on their travels. And for that was a lot of work for people to cancel in that regard. I think one can always go back further and further and say, should we put restrictions back in Christmas and New Year's, which we didn't even know what was going on. So you want to be informed by the data. What does it mean? Because in that time, the travel at that stage, by the information we had from our neighbor to the south, there was only Washington State had an issue, a little bit in California. That was it. There was no evidence of anything going on the whole eastern seaboard at that time. So people felt it must have been okay. There's nothing going on in the Caribbean, and a number of people in other parts of some parts of Europe. It was only certain countries were of challenge in that. We were already worried then about the escalation and saying, would that make it difficult for any travel? Where some countries who had no cases yet at that time, were they possibly of concern? Within a week or so, their numbers started to show, and they went up fairly quickly. So that shows you how fast it moves. So we're trying to inform the public as best we can with the information we have. What's in our control is our numbers. What's happening in the other countries, we have to rely upon them to put that into the public framework and to our attention so we can advise accordingly. So at that stage, we didn't have that information. It seemed to be very much in certain areas, not in the ones of concern to us. But as you've seen, that changed within about a week. And so if we had known before that was going to happen, we would have changed the messaging. But retrospectively, it doesn't help. We have to go forward on the matter.
Okay, if no one else is in the queue, this is going to be the last question.
Okay. Yeah, I guess what I was asking was, I know you need to go on data, but what was your gut telling you at that point? I mean, I remember back then people asking me, should they go away? And I'm saying, I wouldn't go away. So how much are you limited by how much you can go on your gut and how much you can go on data?
Having done this a number of times in the past, I've always been, because my training is stick to the data. Emotions and feelings can lead you into a sense of overreacting or a sense of complacency and casualness. That's a risky business. In my business, we stick to the data. What does the data tell us? What doesn't data tell us? If we don't have the data, how do we go get it? How do we get it better? How do we get it more accurate? How do we get more comprehensive? These are challenges that Dr. Yaffe was talking about yesterday. We've talked about it. We're continuing to talk about it. So I stick to the data. As in the past during the SARS, when I was looking at that aspect there, when people said it's gone province-wide. I said, the data says we have it all epidemiology linked. They said, yes, but what happens if it's got wide? I said, the data tells you it is not. And we stick to that data. And people say, well, emotionally, we feel it might have. Emotionally is not what we operate on. We operate on what we know, and we stick to that. So I will again stick to those aspects there and continue to drive to get the data we need, get the analytics we need, turn to the experts that we have, because we have lots of experts to continue to inform myself, our government, on what we need to do, and to raise those questions about how good it is, how accurate it is, and how do we change our plans and directions. And, of course, as you heard from Dr. Brown and Dr. Donnelly, as we get more data, they'll continue to refine their projections. And so we need to get them the data as they see how we're progressing. And it's like our report card. How are we doing? And how's that measuring up? So we'll continue to operate in that way.
Okay, we actually have another caller that's jumped in, so we'll move forward.
Your next question comes from Mo Fahim with Vista. Please go ahead.
Hi, thank you for taking my call. So my question is about, are there any measures, does Ontario have any measures in place for any international Ontario residents who may not be covered by health insurance but are experiencing symptoms? Because at a time where everyone coming forward with these symptoms is important, this group of people might not want to come forward if they are not covered. Is there anything to deal with that?
I think I got the context correct. I think, all along, we found our communities in Ontario who may be of an international nature have been very forthright in coming forward. We have tried to make it as easy as possible because obviously if they're identified and we can advise and help them in their health condition and to confirm for them very quickly if they have a positive level or not, they can only protect themselves. They often are with other fellow international individuals or in classroom settings or other ones, so they would only want to not only protect themselves but those around them and to be advised accordingly. So we haven't seen that as a problem, and we continue to make that as an effort. We have nearly 90 to 100 assessment centers, and they're more than willing to see someone in that level. You don't have to have the coverage or the citizenship. We want to identify you if we think you're at risk, and you think you're at risk. We want to see you, and we want to help you and assess you, and so that if it is an issue, we can either rule it in or rule it out and give you a peace of mind or the right care when you need it and the right help.
Follow up?
Oh, thank you. That answers my question perfectly. I don't have a follow-up. Thank you very much.
Okay, we'll move to the next caller.
Your next question comes from Antonella Artuso with the Toronto Sun. Please go ahead.
Thank you. Good afternoon, doctors. Further to the modeling question, would you be able to say to what degree, for how long social distancing will need to go on, and also how long we'll have to stay away from workplaces? Are you talking about months or that 18 months to 2-year period?
So part of the modeling is trying to project how COVID-19 will proceed when we haven't seen it before. And excuse me. And so how will that go? And we're being advised by others and models of how it might and could react. Why I'm saying the next phase up, and we've seen here why we're going to really ramp up our contact tracing even more, is that after we've had this first wave of all the travelers coming back and have dealt with that and kept our social and physical distancing in that regard, by doing that case contact tracing and containing individuals who come out within the community, finding out who they're in contact with, it's like in a firefighting situation, you stamp out all those back issues there that could flare up on you if you don't do it, including outbreaks in certain settings, whether it be long-term care facilities, retirement, or other ones. So you continue to bring that under control. The question is that after that time, when there is, and we already have our public health measures group working on this, when you're undertaking this over a prolonged period of time, when does the data tell you, with the amount in the community in that you can start to, I'm not going to say drop, when we've ramped up our public health measures appropriately, And then sometimes we want to do it faster and slower. If we feel it's better, when can we ramp some down? Which ones will not compromise our response, at the same time maintaining our ongoing vigilance and looking for cases and dealing with case contact management to keep that under control. So we're going to be asking our groups on that basis there to give us ideas and metrics to say, when can you start to ease off some things? Because part of that is that you want to maintain what you really need to maintain while giving some people a little bit of a latitude if and when it's allowable. That's not right now. That's not in the next couple of weeks or so. So then therefore, how do you do this on the long run? How do you pace it, and how do you take those times for those little movements in there that'll give breaks in that? So again, the data will tell us. We will watch those numbers. We will endeavor to get those data, to get it more and more accurate and more timely, to make sure that Dr. Yaffe has all those numbers at the right time. But more important for that, how do our experts have the numbers? How do the Dr. Browns and Dr. Donnellys have that and put that into their model and give us some directions and forecasting? We will continue to iteratively carry that process forward and to advise you as Ontarians, much like I said, the coach on the marathon, how far have you gone? How are you doing? What can you do now? And that's going to be our task in the 2 weeks ahead, to see if they're public health measures, how well are we doing? Are we continuing to do that? And as the Premier and Minister we're hoping for, how can we even drop that number down to what Dr. Brown said? If you do this, you could get it down to this level. We'd like to get to that level. So let's get through the next 2 weeks, and then we will see where we go from there.
If I could just add to that, I think that it's important for people to know that the more that everyone does what they're supposed to do now, the shorter the period will be. Like, if we don't do what we're supposed to do, we're not physical distancing from each other, we're gathering, we're not washing our hands, we're not, we're going out when we don't feel well. Those are the things that will keep this going longer and longer. So we want the period to be shorter, obviously, and we want to get back to as normal as we can eventually. But that won't happen until we get everybody, moving in the same direction and working at this. The other thing is there are some new lab tests, laboratory tests that are on the horizon that certainly the ministry the public health lab is looking at, and other labs are looking at, that may be able to help us determine in the long run, for example, how many people might have already had it and be immune, or quicker tests that we can determine that might be able to help us. So there's lots of things that are being developed that should help us as well.
Okay, quick follow-up.
Thanks. Some of the modeling in the U.S. says that in the fall, 95% of the population might have no immunity to COVID-19. Is that similar to what you're thinking about here in Ontario is likely to happen?
So you said that 95% would have no immunity in the States?
Correct.
Well, that depends on their projection, because I've heard different numbers talking about how many might be infected in the next while. Too early to say at this stage, because their numbers are changing extensively. And so we'll have to watch that. I think, because it hints at another thing, too, that Dr. Yaffe was alluding to. While we're doing our public health measures, while we're endeavoring to get those numbers down, other things are moving. They're looking at treatments. They're looking at developing a vaccine. And the longer we delay and flatten, the more time we allow for that to occur. The more time we allow for more personal protective equipment to get produced and made, just like the Premier talked about. The more time it gives us to get more latitude with beds and ventilators and all those other things. So by doing what we're doing, staying the task, as Dr. Yaffe alluded to, that allows our rest of our systems to get better and better prepared in case something does happen. And maybe that we won't need it, but that would be great. We have that anyways. But there are many researchers working on many aspects of that, and I have full hope and confidence that they will come up with things, including a vaccine in a timely fashion. So if you're asking me the immunity in the fall for a large number of their American counterparts, if a vaccine was available, that number may be totally wrong. They may have a mass vaccination program later in the fall, and they would have a large level of immunity. So let's not be, as I said, those modeling ones are projections if all stay still. They didn't say if you bring in a vaccine, you bring in this, as Drs. Brown and Donna would say, that changes things. That goes and alters your projections considerably. So all in time. But right now we have a task ahead of us, especially in the next 2 to 3 weeks, to stay the course, as Dr. Yaffe had alluded to.
Okay, we're moving on, and this is the last question.
Your final question comes from Afua Ba with 105.9 The Region. Please go ahead.
Good afternoon, and thank you for taking my call. My first question is, based on the current modeling and projection that was released earlier today, potentially 1,600 deaths being reported in the province by the end of April alone. They also went on to mention that if increased public health measures are in place, it can drop significantly to 200. We heard yesterday that the City of Toronto, they passed their physical distancing bylaw to make it mandatory 2 meters for everyone who goes out into the public. Would you recommend that physical distancing rule be implemented provincially? Or at what point would you recommend that 2 meter rule be mandatory across the province?
Well, we want that 2 meter. We really have a trust and confidence that Canadians and Ontarians especially will respect that and do that. I've watched them do it. I've watched them remind each other of it. I've had people walk around the other way and do things like that in the grocery stores in different areas as they're implementing new things and telling people to go less frequently, waiting outside in the queue and that. I think what concerned the mayor of Toronto with that, I think it was a frustration that some people are still choosing to do that. We're not talking about the majority. We're talking about a small percentage. And I think that was a method to permit his bylaw officers to take that kind of action for those who choose to be complacent, I guess negligent, and a bit overly foolish, and for some say stupid in the behavior, that they need to have something extra force to bring them back into line, because the rest are doing their part, and those ones who need to be reminded, if that means by a bylaw officer, to do so. And I think you're going to find various communities doing different things to endeavor to say for those people who are recalcitrant or irresponsible in their behavior are going to be made to take that consideration seriously. So these are all things that we can do to ramp up that and to deal with that small percentage and yet a concerning percentage of our public.
We have time for one very quick follow-up, and then we have to wrap up.
Oh, no follow-up for me. Thank you very much.